Welcome everyone to Med Talk Zambia. My name is Makayi, a student at Levi Mwanawasa Medical University, studying Bachelor of Medicine and Bachelor of Surgery in my second year. Yes, in today's Med Talk, I'll be discussing asthma. We're going to know common asthma attacks, signs and symptoms of asthma. To begin with, without wasting time, what is asthma? Asthma, which is also called a bronchial asthma, it is a disease that affects your lungs. It is a chronic, that is, ongoing condition. It does not go away and needs ongoing medical management. It can be life-threatening if you do not get treatment. So, like when you breathe normally, muscles around your airways are relaxed, letting air move freely and quietly. But during an asthma attack, three things can happen. 1. Bronchospasm. The muscles around the airways constrict. They tighten. So when they tighten, it makes your airways narrow. Air cannot flow freely through constricted airways. Another thing is inflammation. The lining of your airways becomes swollen. Swollen airways do not let as much air in and out of your lungs. Third thing that will happen due to asthma attack, mucus production. So during the attack, your body creates more mucus. So like thick mucus clogs your airways. You cannot breathe properly. So when your airways get tighter, you make a sound called wheezing. That sound, the wheezing, is like whistling sound when you're breathing out. Yeah, it's very noisy. So you might also hear an asthma attack called an exacerbation or a flare-up. It is a term for when your asthma isn't controlled. So we've talked about what asthma is. Now let's see types of asthma. Asthma is broken down in two types based on the cause and the severity of symptoms. So healthcare providers identify asthma as intermittent. This type of asthma comes and goes, so you can feel normal in between asthma flares. Another one is persistent. Persistent asthma means you have symptoms much of the time. Symptoms can be mild, moderate, or severe. Asthma has multiple causes. It can be allergic, non-allergic. So like for allergic, some people, allergies can cause asthma attack. Allergens include things like molds, pollens, and paint dagger. What about non-allergic? Outside factors can cause asthma to flare up, like exercising, stress, illness, and weather may cause a flare up. Asthma can also be adult onset. This type of asthma starts after the age of 18. Another one that comes in children called pediatric, also called childhood asthma. This type of asthma often begins before the age of 5, and can occur in infants and toddlers. Children may outgrow asthma. In addition, there are these types of asthma: exercise-induced asthma. This type is triggered by exercise and also called exercise-induced bronchospasm. Another one is occupational asthma. This type of asthma happens primarily to people who work around irritating substances. Yes, but also asthma overlap syndrome, ACOS, asthma overlap syndrome. This type happens when you have both asthma and a chronic obstructive pulmonary disease, COPD. Both diseases make it difficult to breathe. Yes. So that is that. Now, who can get asthma? Can I get asthma? Can you get asthma? Let's find out. Anyone can develop asthma at any age. So people with allergies or people exposed to tobacco smoke are more likely to develop asthma. This includes second-hand smoke, that is exposure to someone else's smoking, or third-hand smoke, exposure to a clothing or surface in places where some has smoked. Yes, you can get asthma like that. So anyone can get asthma. You take care of yourselves. So what are the symptoms and signs of asthma? What causes asthma? By now you should know that allergy is one of them. So having allergies can raise your risk of developing asthma. And also environmental factors. People can develop asthma after exposure to things that irritate their airways. These substances include allergens, toxins, fumes, and second or third hand smoke. This can be especially harmful to infants and young children whose immune system has not developed fully. And also genetics. If your family has a history of asthma or allergic disease, you have a higher risk of developing the disease. So asthma is genetic as well. And respiratory infections. Certain respiratory infections such as respiratory syncytial virus (RSV) can damage your young children's developing lungs. Yes. Now, what are common asthma attacks? What triggers it? So you can have an asthma attack if you come in contact with substances. Talk about this that irritate you. Yes. You can have air pollution, dust mites, exercise, mouth, paste, tobacco smoke, strong chemicals or smells, and certain occupation exposures. Talk about all those stuff that can cause asthma. So it's better to be on the lookout for those. So people with asthma usually have obvious symptoms. These signs and symptoms resemble many respiratory infections. Like other infections. Asthma has chest tightening, pain or pressure, coughing, especially at night, and also shortness of breath and wheezing. That is a whistling sound when you're breathing out. That makes noise, You're breathing out like that. Yeah, that's whistling sound, wheezing. So with asthma, you may not have all these symptoms with every flare. You can have a different symptoms and signs at different times with chronic asthma. Also, symptoms can change between asthma attacks. So that is what asthma is. So that's a reminder to everyone. Need to take care of ourselves because asthma can be gotten by any one of us, just like we've discussed. Good health, everyone.